Nursing fam, let's master the most tested maternity medications in just 5 minutes. I'm talking zero fluff, just the exact high yield facts and clinical priorities you need to absolutely crush your exams using this explainer. So grab your notes and let's get right into it. We're literally going to follow a real clinical shift chronologically today. We'll start with preterm labor and preeclampsia, then we'll run straight into the labor and delivery room for induction, tackle postpartum hemorrhage, and finally, focus on the newborn. Oh, and stick around because we're locking all of this in with a high-stakes NCLEX Final 5 quiz at the end. All right, first up on our shift, we're caring for a patient with preeclampsia, which means we instantly need to talk about our absolute ultimate priority medication, magnesium sulfate. Listen to me, the NCLEX is going to test you on this for sure. Magnesium sulfate is a massive central nervous system depressant. We primarily use it in preeclampsia to prevent seizures. And because it causes smooth muscle relaxation, it can also halt preterm labor. But here's the exam hack you've got to remember. Because it depresses the CNS, that same depression can super easily cross the line into life-threatening toxicity. You absolutely need to memorize this toxicity trio. When your patient is on a continuous MAG IV drip, you're hunting for 3 major red flags. 1. Respirations dropping below 12 breaths a minute. 2. Absent deep tendon reflexes, like if you check their patellar reflex and get absolutely nothing. And 3. A urine output of less than 25 to 30 mils an hour. If you see any of these, you've got a critical safety alert on your hands, because respiratory paralysis could be literally right around the corner. So, what do? Well, first, you stop the infusion, but you also must know the antidote, which is calcium gluconate. It's got to be readily accessible, like ideally right there in the room with you at all times when a patient is on MAG, because it directly antagonizes those toxic effects. Okay, moving on. We are now in the delivery room. Our goal is a safe delivery, and our superstar uterine stimulant here is oxytocin. Oxytocin does exactly what it sounds like. It stimulates the smooth muscle of the uterus. It cranks up the force, the frequency, and the duration of those uterine contractions. We use it all the time for the induction or augmentation of labor. But because it's so incredibly potent at forcing the uterus to work, it demands super close, continuous monitoring of both mom's vital signs and the fetal heart rate. Safety alert, guys. If you see hypertonic contractions, meaning that uterus is just contracting way too much and not getting a break, or if you spot a non-reassuring fetal heart rate, you have a full-blown emergency. Here is your strict order of operations. Step 1. Stop the oxytocin infusion immediately. Before you turn her, before you grab oxygen, you stop the med causing the problem. Then, turn the client on her side, increase the IV fluid rate, and give her oxygen by a snug face mask. All right, baby's out. But hold up. Our maternal risk isn't over just yet. We need to talk about postpartum hemorrhage. If mom is bleeding, we often reach for methyl-ergonovine. Write this down, it's a massive exam hack. Its desired effect is producing firm uterine contractions to stop postpartum hemorrhage caused by uterine atony. It works absolute wonders. But, and this is a huge but, it is a very powerful vasoconstrictor. That means giving it to a patient who already has hypertension is an absolute never event. It can cause severe, life-threatening spikes in blood pressure. Always check the BP before you give this med. Okay, mom is safe. Her bleeding is totally controlled. Let's shift our priority to the newborn and look at those essential immediate prophylactic meds. Welcome to the golden hour. Within the first hour of life, you have 2 critical jobs. First step, vitamin K, or phytonadione. You give this IM right in the vastus lateralis muscle of the thigh. It's essential to prevent hemorrhagic disease because newborns are basically born with a sterile gut. They don't have the bacteria to synthesize their own vitamin K yet. Second, erythromycin eye ointment. This is legally required prophylaxis to protect the baby from ophthalmia neonatorum, which is caused by gonorrhea and chlamydia during birth. Okay, nursing fam, you've got the facts. Now it's time to lock it all in with the NCLEX Final 5 interactive quiz. I'm going to read the question, give you a few seconds to think it over, and then we'll break down the answer together. Let's do this. Question 1. A client on magnesium sulfate has a respiratory rate of 10 and absent patellar reflexes. What is the nurse's first action? A. Administer calcium gluconate. B. Continue monitoring. C. Discontinue the infusion. Or D. Notify the HCP. Read this carefully, think about your priorities, and lock in your answer. And the correct answer is C. Discontinue the infusion. Look, when you see respirations below 12 and absent reflexes, you are looking at straight-up magnesium toxicity. You must remove the dangerous stimulus before you even think about pushing the antidote or paging the doctor. Stop the drip first. Next up,
Question 2. Which assessment finding would make the nurse withhold a dose of methyl-ergonavine? A. Blood pressure 152/98. B. Pulse 110 beats per minute. C. Respiratory rate 16. Or D. Temperature 37.8 degrees Celsius. Look for the red flag vital sign here.
The correct answer is A. Remember, methyl-ergonavine causes severe vasoconstriction. So that high blood pressure? That is your immediate cue to withhold the drug and notify the provider. It is strictly contraindicated for anyone with hypertension. Moving on to question 3. During an oxytocin infusion, the nurse notes contractions every 90 seconds. What is the priority nursing action? A. Turn the client to her side. B. Stop the oxytocin. C. Increase IV fluids. Or D. Administer oxygen. Think about your exact order of emergency actions for hyperstimulation. If you guessed B, you nailed it. Contractions every 90 seconds means uterine hyperstimulation. Now, all of these options are correct emergency actions, but stopping that IV infusion is the ultimate first priority to protect the fetus. Always stop the offending agent first, right? All right, question 4. Why is vitamin K administered to a newborn within the first hour of life? A, to prevent infection. B, to assist in lung maturity. C, to prevent hemorrhagic disease. Or D, to promote jaundice clearance. Why is this specific injection so critical for the neonate? The correct answer is C, to prevent hemorrhagic disease. Like we talked about, newborns are born with a completely sterile gut. Until they develop their own intestinal flora to synthesize vitamin K naturally, they rely entirely on this injection to produce the coagulation factors needed for blood clotting. And finally, question 5. An Rh-negative mother is 28 weeks pregnant. Which medication does the nurse anticipate administering? A. Betamethasone. B. Rho-D immune globulin. C. Rubella vaccine. Or D. Misoprostol. Think about the standard timing protocol for blood compatibility. The correct answer is B. Rho-D immune globulin, you probably know it as RhoGAM, is given at 28 weeks gestation and then again within 72 hours after delivery for an Rh-negative mom. This prevents isoimmunization, which protects her future pregnancies from antibody attacks. That makes 28 weeks a huge clinical milestone. Awesome job today. So, score check. How many out of 5 did you get right? Be honest. If you missed the ones on magnesium or oxytocin, seriously go back and rewatch those sections. Repetition is totally key here. Comment your score down below and let me know what we should tackle next in our explainer series. But before you go, I'm going to leave you with a little brain teaser. What if your postpartum patient is hemorrhaging, but she also has severe preeclampsia? Which emergency med do you reach for then when methyl-ergonavine is completely off the table? Think about it, trust your training, and I'll see you in the next one.